Good day, everyone. Welcome back to our channel. We do hope you've learned one or two things from our previous videos, and we do appreciate your support up to this moment. If you are here to subscribe to our channel, kindly subscribe to our channel, and don't forget to click the notification bell so that when next we upload a video, you are going to get notified. So today we want to talk about type 1 diabetes. Just like we've mentioned in our previous video, that diabetes, it is an increase in the blood sugar level which is persistent and which basically is abnormal. And we do mention that there is type 1, type 2, and gestational diabetes. Although, according to World Health Organization, diabetes mellitus is classified into 6 different categories. So, but basically the most popular one, which are the type 1, type 2, and gestational diabetes. So today we want to talk about type 1 diabetes. Type 1 diabetes accounts for 5 to 10% of diabetes, and it is the most diagnosed diabetes in persons under age of 20. So basically, whenever someone is under age of 20 is diagnosed of diabetes, it is most likely that the diabetes is going to be type 1. So there are some features that are peculiar to type 1 diabetes. For example, it usually occurs in younger people, so which may have thin body or they may have normal body, and also it is related to metabolic acidosis, or simply put, it's related to ketoacidosis. So unlike in type 2 diabetes mellitus, which is not related to ketoacidosis, it has sudden onset, and there is usually auto-antibody which is present and is related to the condition of type 1 diabetes. We want to look at the case of insulin level in type 1 diabetes and the frequency. The concentration of insulin in type 1 diabetes cases are usually low or it might be absent. And the frequency, the type 1 diabetes occurs in about 2 or less individuals in population of 1,000 individuals. The basic causes of type 1 diabetes is as a result of low, insufficient, or total absence of insulin. And the absence or insufficiency of insulin is as a result of loss of insulin producing beta cells of the pancreas islet. So this is usually referred to as immune mediated or idiopathic. So the loss of the beta cells which produce insulin might be as a result of autoimmune disorder, or it might be idiopathic, which means there is no particular specific explanation to what caused the loss of the beta cells of the pancreas islet, which later result into low or insufficiency or total absence of the insulin. Like I just explained, the loss of insulin producing beta cells might be as a result of autoimmune by the T cells, which causes loss of the beta cells of the pancreas islet, and as a result of that, there will be no production of insulin, and as a result of this, the type 1 diabetes mellitus occurs. Unfortunately, type 1 diabetes mellitus is partially inherited. So which means if one's parents have it, then the offspring, which is the children, is at risk of developing this condition. Thank you so much for following this video to this moment. In the next video, we'll be talking about type 2 diabetes so that we can differentiate between type 1, type 2, and gestational. But in this video, we have been able to establish the fact that for case of type 1 diabetes mellitus, there is low level of insulin, or insulin is totally absent. So we now look at what happened to insulin when we talk about type 2 diabetes mellitus and gestational diabetes mellitus, and at the same time, how to prevent this diabetes and how to manage it for those who have the condition. Thank you so much. We do hope that you subscribe to our channel. Don't forget to share this video, like the video, and let us have your comments or opinion in the comment section. Thank you so much. Bye for now.